Hi, everybody. Pamela D Wilson here, caregiving expert, advocate, and speaker. We are back to talk about dealing with stubborn elderly parents and noticing the little things. This is something that I cannot stress enough because many times the little things that we do or don't notice can make a significant change in an elderly parent's life. How many times do you have that little tap on your shoulder that says, notice me, you should pay attention to this. There's something wrong with your car or something's going on at work, and you don't pay attention to it, and you end up with a flat tire, or you end up not finishing a project at work. These little taps on our shoulder are taps to help us notice the little things. And in this part, we are going to talk about the importance of noticing the little things. Stay with me as usual. We are going to go through housekeeping and then we will get started with everything. You probably can recite this to me by now, but elderly parent, elderly parents, that is the term for the person you are caring for. The outline for this module, if you have not found it, is in the course materials for the program. And I hope by now, every time you have the slide handouts printed out so that you can make notes and follow along with me. The objectives of noticing the little things should help you be able to differentiate between regular activities and abilities and signs of decline in activities and health. You'll also be able to detect changes in activities of daily living so that you can prevent safety or health risks. And we'll talk about resisting the tendency to take over that we do talk about quite a bit, but it's not always good for your elderly parent, even though for you, it may be more time efficient. Little things, small things, changes in health and cognitive abilities represent an increased need for daily care and support for elderly parents. Look at the everyday situation of your parents. How have the abilities of elderly parents changed in the recent month, 3 months, 6 months, or a year? Are your parents doing better physically and emotionally? What changes are you noticing? From a physical perspective, what can your parents do or not do that they did 1 month, 3 months, 6 months, or a year ago? Are mom and dad still as physically active as they were? Can they walk a mile? Can they walk up a flight of steps without becoming winded, without breathing like they're out of breath? Can they stand from a chair without rocking back and forth? You've probably seen your parents do that just to get the momentum to get up. Can they stand from that chair without doing that and stand? Do they have any type of balance issues? Have they experienced falls? When they walk, are they balanced? Is their gait level? Can they easily put one foot in front of another? When they walk around the house, are they holding onto furniture? Physical declines, and we'll continue to talk about this in all of these modules because it progresses and we learn more. Physical declines are one of the main reasons that elderly parents experience falls. Significant falls can result in a broken hip, broken shoulder, or arm, and these can lead to more severe health consequences. Parents may have no choice but to move from a home to a care community if they can't remain independent and manage their daily care at home. Chronic disease contributes to more health declines. As we've talked, heart disease, breathing issues, COPD, asthma, diabetes, arthritis, kidney, mental illness, and related conditions in combination create a mountain of health issues for elderly parents if they're not well managed. One of the goals in helping elderly parents, which also helps us as caregivers because we learn, is to become more educated about chronic disease to avoid what I call the "no one told me" syndrome. A diagnosis of blood pressure is like a gateway drug. It's a gateway diagnosis to other more severe health issues. But doctors don't really discuss the long-term consequences of high blood pressure. High blood pressure can result in heart attacks and surgeries, like the placements of stents, having bypass surgery. High blood pressure can also result in circulatory issues, strokes, vision loss, memory loss, kidney and other diseases. It's our responsibility as a caregiver and our responsibility to help our elderly adults to talk to doctors and other medical staff about all of these diagnoses and to ask questions about the consequences. Because here's the problem. The healthcare system and health insurance companies, they are rewarded for diagnosing and treating diseases. These efforts to diagnose and treat, they're what drives health insurance costs because they're measurable. You can give a diagnosis code to high blood pressure. You can say this happened because of this. The problem is discussions about prevention and long-term health consequences, they're not measurable because if you're going to prevent something, you'll never have a diagnosis code to write down on a piece of paper that insurance can reimburse for. So because prevention is not measurable, it's not financially rewardable, which sounds crazy, doesn't it? Improving the health and well-being of ourselves and our elderly parents, it's our responsibility. We have a personal responsibility to pay attention to health, participate in physical activity, exercise, and monitor nutrition that can result in good health and well-being well into our older years. But these results, these actions, they require intentional action and a lot of self-discipline that sometimes we may not have. Much to our surprise, health issues begin early in life. And health issues begin from our daily health habits that eventually, unfortunately, after the age of 40, start contributing to a diagnosis of chronic disease if we were unaware of health prevention actions and habits. Let's start by talking about memory loss. Research now has it down. Signs of memory loss are present 10 to 20 years before a formal diagnosis. That's almost a quarter of our life. One might wonder how on earth this is possible. Remember our conversation about high blood pressure and circulatory issues? Here's how it works. Circulation of the blood and oxygen goes through our bodies. It keeps us going. It is vital. When that blood flow becomes weak because of heart conditions, high cholesterol, triglycerides, high blood pressure, you have a stroke, you're overweight, you smoke, you have diabetes. These conditions cause something called ischemia. It's spelled I-S-C-H-E-M-I-A. And over time, ischemia results in this low blood flow to parts of your body. So when our heart's not pumping, our brain is not getting enough oxygen. This results in vascular dementia. And I want to share yet another story. And this one relates to ischemia related to smoking. So my mother was a smoker, pack of cigarettes a day, didn't realize how bad it was for her. But when I was a child, she had all these health issues. She would burp and she would drink like a bottle of Maalox in, 2 or 3 days. Always had indigestion. She had hiatal hernias, just miserable from a digestive standpoint. So what I learned in my caregiving years, and actually there's a podcast on this one too, Dr. Brooks Cash, amazing doctor from Texas, but talk to him about the relationship between smoking and digestive problems, which nobody talked to us when my mom was sick. Nobody really said, well, they may have said, her mom my mom's name was Rose. They may have said, well, Rosie, you should give up those cigarettes. They're bad for you. They're causing heart disease. Back then, nobody ever said, Rosie, the reason you're so miserable from a stomach and eating perspective is because you smoke. Smoking affects all of the organs in the middle of our body, and it causes ischemia. Smoking clogs our blood vessels and our arteries. And when parts of our body that are in our stomach don't get oxygen, they don't work as well. People who smoke are more likely to have GERD, indigestion, hiatal hernias, irritable bowel syndrome, all types of miserable digestive problems, where if they would just stop smoking, that might improve. If you smoke, if you know somebody who smokes, go see a gastroenterologist if you are having tummy issues. The smoking is the reason. The loss of blood flow is the reason. The ischemia is the reason. You'll hear me continue to talk about how one part of our health is affected, the next part, and the next part, and the next part. All of these chronic diseases, they work together to result in geriatric syndrome that we will eventually talk about as we continue to build from section to section and part to part and module to module. So let's continue. Early signs of memory loss. Early indicators of memory loss are difficulty managing money and finances and numbers. So these are the things that can be noticed 10 to 20 years before a diagnosis, like we talked. And I have one more story. This story actually relates to my story about meso-meso. So if you remember when we talked about the 4 stages of caregiving, one of them was meso-meso, which means 1 foot in, 1 foot out, half and half. And the way that I came up with meso-meso was from my experience with 2 clients. One was my client from Italy. This story is about my client from Italy. When I first met her, I was introduced through Adult Protective Services. So a neighbor called because they were worried that she might not be taking good care of herself. She was still driving a car, had a couple of fender benders, was starting to have some difficulty. And so at the time when I met her, I noticed some things. And these are the little things that you can notice. So I went over her house and she kept a calendar. But she had all these, you guys have sticky notes, these sticky notes. She had sticky notes all over the place. She had them on her cabinets, on her refrigerator, just everywhere. And so I'm like, what are all the sticky notes about? And she's like, well, I'm getting a little forgetful. I got to remind myself to do things. And I'm like, okay. Then I noticed that she had piles of mail stacked on her kitchen table. And I would visit and they would be there. And the next time I would visit, the mail pile would continue to grow and grow. So I said, can I start helping you go through some of that mail? Well, what I discovered is that she had past due bills. She had threatened shutoffs of her health insurance plan because she hadn't paid her premium, all kinds of things. And so over time, I became her power of attorney and started to help her with all of these little things. But it's all of these little things that if you're not in close contact with an elderly parent, if you live 1,000 miles away, if you don't visit, you may not notice them. You may not even notice them through phone conversations, which then leads you to rely on other people and friends if they even exist. A lot of elderly people live alone and they don't have family near. And so because of that, they fall into these patterns where they're not able to take care of themselves, and professionals like myself get involved. So that's my story of noticing the little things with the lady who gave me part of the 4 stages of caregiving, meso-meso. So let's talk about other signs of decline. What changes are you noticing in behavior, daily activities, or conversations with your elderly parents? Let's start with dress and hygiene. Were your parents always well-dressed and now maybe they're a little sloppy? You might attribute that to being retirement because they don't have to get dressed up for work anymore. But there's a difference between relaxed and unkempt or sloppy. Did mom or dad always take pride in their appearance, and today they're in dirty clothing or unironed clothing or sloppy clothing that they would have never thought to wear before? They would have thrown out a torn shirt. They wouldn't be wearing a torn shirt. Do you visit and you're noticing that your parents are wearing clothing that has food stains, which may indicate they're putting on the same clothes day after day? What does their hair look like? Do they have bad breath? Are their teeth brushed? Was the bathroom in the house always clean? And today, everything looks like it could use a really good scrubbing. Is the house having an odor? Are they not taking care of pets like they used to? Are you noticing underwear hanging out to dry in the bathroom? If you talk to your parents about showering or taking a bath, do they say, oh, yeah, honey, we took a bath or a shower this morning? And you look at them and you look at their hair and it's dirty. And you know by just looking at them that they probably didn't take a bath or a shower that morning. Or if they did, they certainly didn't wash their hair. So these are all of the little signs that you want to notice about what's happening. So it's the question of, is there this? And why is it happening? Let's talk about nutrition, which is another extremely important component of older people remaining healthy and staying at home. Was your mom a really good cook? And now she's not cooking. You're noticing like open cans and frozen dinner trays in the trash. Have your parents lost weight? Sometimes it's difficult to notice because clothes can be baggy. If you look in the refrigerator, are there spoiled foods? Are there canned goods in the cabinet that have been there for like 5 years? Do your parents mention that they're not hungry or that they're tired? The idea of not feeling hungry can relate to not being physically active. When we're not active, we don't work up an appetite. Low levels of activity result in this cycle for elderly parents of not feeling well, not being hungry, losing physical strength, losing muscle mass, being tired, not having good balance. All of these lead to more health problems. And there could be other issues. Cooking might be more difficult for mom or dad because maybe they can't stand up for long periods of time because their feet hurt or they have poor circulation in their legs. Maybe their hands are not strong enough to open cans or use cooking utensils because of arthritis. Maybe driving is becoming an issue. Maybe they're worried about driving to the grocery store or they can't carry in the heavy items. As you notice these, and we will repeat this conversation, but you want to ask your parents by saying, you know, mom or dad, I'm noticing this. Are you noticing this too? That opens up conversations. Let's talk about the importance of medication management and health. Does it look like parents are taking their medications? If you pick up a prescription bottle, is it full? What's the fill date? Does the quantity of pills remaining look like it matches with the fill date? Or is the fill date 30 days ago and there's still 30 pills in that container? Are there empty bottles there that were due for a refill last week, last month, couple of months ago? The steps involved in managing medications include the need to see the doctor every 6 or 12 months to obtain refills. Are your parents scheduling regular doctor appointments? Other actions that relate to managing medications for elderly parents involve calling in for refills, going to pick up the prescription, taking the medications as prescribed. Is your mom or dad using any kind of system like a medication box that you can find usually sitting in the section by the pharmacy? For me, I take vitamins. I take a lot of vitamins. It's easier for me to use one of those medication boxes so that I don't have to open up bottles every morning or evening. That would be time consuming. For me, it would be a hassle. So what I do is I fill 2 weeks of medication boxes with my vitamins. Doing this lets me plan for running out within the next week or two. So if I am running out of something, I can order it before I need it. If your parents aren't using medication boxes or some type of system, this is really something to consider. Medication management is another area that can be challenging because it does take a bit of organization. And if your parents aren't organized or are experiencing early memory loss, this level of disorganization is one of those little signs that something might be wrong. Not taking medications as prescribed adds to health issues, and elderly parents go to the hospital emergency room for treatment because they don't take medications properly. How do we have these conversations without upsetting our parents? So look at other things that are happening that you can use as an opener. Other changes for elderly parents can include maintaining a home and a yard. This may be one of the first areas that you notice long before you notice health issues. As we age, it's easy to become less attentive to our home and our yard because it takes more effort to clean or maintain the house or the yard. Maybe your mom was a great housekeeper, not anymore. Maybe your dad enjoyed mowing the lawn and keeping up with the lawn, and you're noticing it's taken over with weeds. So ask yourself, are the physical requirements of maintaining the house becoming too much for an elderly parent? There are many reasons for these little changes and changes in daily habits, and these are the little signs. When you notice a change, it's a little sign that something has changed, that something needs attention, and it's time to begin asking questions. So you say something like this, Mom or Dad, I'm noticing that the yard's not mowed and there's more weeds. Is there anything I can do to help with this? You want to wait for your parent to respond so that you can see if they notice the same thing. It's the best way to ease into a conversation about what your parents can and can't do to care for themselves, about their abilities, without making them feel like they should feel bad, or you're thinking that they're not taking care of themselves, or that they feel like they're under your examination. If your parent refuses help or fails to acknowledge the change, let that conversation go. Bring it up again in a visit or a phone call, because as we talked, admitting that they can't do something for a parent, it could be difficult, it could be embarrassing. We don't want to embarrass them, but we have to be persistent because these little things can lead to bigger things. Be kind, be patient, be so empathetic, be overly empathetic. For example, Mom, this cooking concern, this driving concern, whatever it is, incontinence. It happens as we all age and have more health issues. It's going to happen to me someday, I know that. What can I do to make this easier for you? That should open up the conversation, which then leads to you as the caregiver having to resist taking over. Being a helpful caregiver for elderly parents is a positive thing. However, caregivers can be too helpful. That's the other side. That's the negative. The goal of helping elderly parents is to help them remain as independent and able as long as possible. When you take away tasks and activities that you view as difficult, challenging, or unsafe, but that your parent can still perform safely, maybe slowly, but safely. Your parent becomes less physically and cognitively able when you take those things away. As adult children, we know this. We work, we live on a fast time clock. Our elderly parents live on a slow time clock. We're scheduled, we have lists, we're time pressured, we are rushed. Our elderly parents, they have all the time in the world. You may have noticed that it's taking more time for your elderly parents to complete activities That's okay. Mom or dad might become distracted in the middle of a task. They might delay completing the task or leave it to another day. Slowness and distractions are precisely the reason you want to allow your parents to do the activities at their own pace. The effort and the time that it takes them to complete a task, think of it like having a job. Think of it like them working. This time is spent in positive physical activity, positive mental activity. They're doing something instead of sitting in a chair all day. Sitting in a chair all day, bad. Being active, good. So the more that you only do the tasks that you have to for your elderly parents, the better. Let them do it ever so slowly. Help your parents remain independent instead of becoming increasingly dependent on you sooner than they need to. So let's talk about summarizing, noticing the little things. Changes in physical activity, changes in mental activity are warning signs that elderly parents need more help. Early discussions of concerns is the best way to slow the need for more care. Changes in strength, endurance, balance, all of those, so important to notice early, because the earlier that you can notice them, the more you can reduce safety risks and other health issues. So as we continue to go through these stages of caregiving, you will notice that you will make forward progress. You'll stabilize the situation with an elderly parent. You may take a few steps backward, then you move forward again. This is what we call adjusting to the new normal. In life and in caregiving situations, there are many instances of adjusting to the new normal. When I managed care for my clients, we would all take a breath of fresh air. It was like, phew, thank God we've got everything stabilized. And our clients would do well, health issues would be smooth, everything would be great. And then all of a sudden, we'd have a crash. And we would be then very involved in trying to come to another point of stability and maintain things again. And then things would again go along very well. And then we'd have another crash. This is what happens when you care for elderly parents when they are in the meso stage and the home run stage. Their health needs become greater. You're up and down in caregiving situations. But by becoming more educated, by learning what can happen, even though if some of those things that can happen are not positive and they're difficult, it's better to know, it's better to plan ahead so that you can avoid all of these issues. The small things that you notice, they can never be too small. They are important. Notice these things with your elderly parents and do yourself a favor. Notice them for yourself. Everything that we are learning here about care for our elderly parents applies to us, our families, our children, so that we are in better health when we age. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. Thank you for joining me. It has been a delight. I will see you in another webinar.